Hello, good afternoon, friends. How are you? I hope you are fine and ready our next lecture for X-ray anatomy. Please don't forget to put your name and group number in the chat. Okay, let's start. If you hear me well, everybody can hear me. Please write it. Good, fine. So today topic is the very interesting topic. It is interesting also for anatomy and for clinic. That is the X-ray anatomy of bones and joints. So let's start studying. More than 100 years have passed since Konrad Röntgen discovered X-rays. Now X-rays are used everywhere. They help us to find defects in engineering structures. They checked passenger luggage, study organs, and of course X-ray guard human health. X-ray diagnostic today is the best and most reliable doctor assistance, especially for examining our skeleton. But without knowledge of X-ray anatomy, it is impossible to conduct X-ray examination of your patient. Therefore, today we will talk about X-ray method for studying our skeletal systems. A couple of words about history. Wilhelm Konrad Röntgen, his picture, is German physics who lived in small city called Würzburg in Germany. Röntgen was the first man who detected electromagnetic radiation in wavelength range from 5 to 10 nanometers, and it is known now as X-ray or Röntgen rays. More common in foreign universities, in Western university call it X-ray, but in our country we often call Röntgen rays in German manner. This achievement earned Wilhelm Röntgen the first Nobel Prize in Physics. It was in 1901, and it was the first Nobel Prize in Physics. You can see the right picture. This is the X-ray of Frau Bertha. She was a wife of Röntgen. It is wife Röntgen, Frau Bertha, and it is the first X-ray radiograph in the world. It was done on November 8, 1895. I would say that the Wilhelm Konrad Röntgen was a very real scientist, and it is worthy of respect that he refused to patent his invention, because this scientist believed that his discovery should belong to all of humanity. Okay, and next slide shows the first X-ray generator. This is the left picture. It is the same what was done in Röntgen laboratory, and this is like his Frau hand. But right picture is that is what how look lies how look the it is picture of first X-ray machines. I'd like to add that why the discovery of X-ray was so necessary. Why after only 6 years after his invention, Röntgen got Nobel Prize. In the late 19th century, many people fell ill and died from tuberculosis. This is an infection disease, and only using of X-ray made it possible to identify foci of tuberculosis in the lungs, in human lungs, and it was possible to do an early stage, and then doctors could begin treatments. So it is very interesting. There is funny story about one rich but not a very educated man who wrote a letter to Röntgen asking him to send some X-ray in the mail. Röntgen was quite educated person, and he replied to this nobleman that it would be easier if he sent to Röntgen his chest by mail. Okay, and many years have passed since the discovery of X-ray, which are used everywhere, but today there is a special section in human anatomy that studies the images of organs on X-ray. It's called X-ray anatomy, and we start X-ray anatomy today. What is it? X-ray anatomy is a theoretical discipline at the intersection of anatomy and radiology. It is combined from anatomy and radiology. It studies structural patterns of X-ray images of different parts of human body. And it is not so easy when you can think firstly. It is not easy to understand all structure on the real X-ray images. X-ray anatomy is an integral part of normal anatomy, of human anatomy, and it is of course a part of anatomy. It is a necessary component of the training of doctors in radiation diagnostic. It is also used as an actual method in teaching in all medical university, as well in our university. We teach X-ray anatomy of the bones of the skeleton, chest organs like lungs and heart, and we examine other internal organs like digestive tract, cardiovascular system, urogenital systems, etc. And you should be good at identifying anatomical structure on X-ray images. And I hope today's lecture will help you to identify all structures, all skeleton structures on X-ray images. Couple of words about X-ray technique. Unlike visible light, X-ray pass through our body. The research object is placed, like here, placed between the X-ray source, here or here or here, it is X-ray source, and between the receiver, here is the receiver or here is the receiver. When X-ray pass through body, some of X-ray are absorbed by the organs and hit the receiver. Receiver converts the X-ray into electrical signals that are displayed on the screen. Previously, doctors used to use a film with a silver salt. It is special chemicals what was put on the surface of the film, and it react with X-ray, and it was possible to see how X-ray come through our body. That was done firstly when Röntgen invented X-ray, but now more common using a receiver, special very complex electronic device. Different human tissue absorb X-ray to varying degrees. For example, bones absorb X-ray as much as possible. Muscles and dense parenchymal organs like liver, kidneys can absorb X-ray less. More or less absorb X-ray skin and adipose tissue. But the least X-ray absorbing anatomical structure are organs containing air. It would be trachea, bronchi, lung tissue, loops of the small and large intestine. So it depends on what kind of structure we see in the X-ray image. It depends on the possibility to absorb X-ray radiation. Maximum for bones and minimum for organs containing air. Reading how we can reading and how we see what we see on X-ray images. Mostly, not all, but a lot of mostly X-ray images are negative images. So negative means that it is when the white is black, and black in contraposition is white. So organ that absorb X-ray well on the negative look like, and they are called shadows, like here is shadows, we call it. They are white but in negative, so we mean that it is a structure what absorb X-ray very good. Another black spot or black areas, that is the structure what absorb X-ray in small way, very easy absorption of X-ray. So we call them lights or Lucians sometimes. Please don't be confused. When we talk about bones and see bones on the negative image, we call them shadow, but in real they are white. And when we see area, we call them lights, but they on the negative are black. And the most difficult situation you have when we try to analyze X-ray images, because every X-ray image is a two-dimensional image of a three-dimensional objects. What does it mean? In a two-dimensional image, like here, various anatomical structures are layered. It is visible how ribs cross each other on the image, and sometimes it is very difficult to understand what kind of structure. For example, see please, this is the sixth cervical vertebra, and you see the arcus of vertebra. But what is this? What is this in the centrum? It looks like a drop, but in real that is a processus spinosum. And for example, what is this? What is the lights in the centrum? Here I show you the lights, but that is larynx and trachea. This organ contain air inside, and they look like lights or lucines. Okay. Another idea when we talk about X-ray images, that is the rule when radiographs or X-ray images are taken in two projection. Two projection is obligatory. Why? This is necessary for correct identification and interpretation of bone fractures. Let's take, for instance, a fracture of the humerus in lateral projection. Here, left image. We can see the fracture line here. Here's a fracture line. But for the first look, it is not severe fracture. It is not hard fracture. But if you take a frontal projection, that is a lateral projection, but if you take frontal projection, you will really see a very complex fracture, and it is visible only in front projection. You can show this image to the patient's relatives, but this one, the right one, or both one, you can use for the surgical treatment. Okay, I'm kidding. So another idea for doctors, for surgeons, in order they will not confuse with what kind of hand, what kind of shoulder, what kind of humerus they will operate. Usually techniques put a label here, you see. They indicate by the letters L or right. What does it mean? L means left, R is right. So it is visible that is left shoulder, left humerus bone was damaged. And sometimes you see the letter in Russian, it would be P and L, what means правый and L левый. That is only in Russian, in Cyrillic letters. Okay, so don't forget, usually we need 2 projection for every X-ray images, especially for when we are talking about fractures. And for usually to read radiographs or to read X-ray images, we need a special apparat or special device we call negatoscope. Negatoscope is here. It creates an evenly light background for viewing. It is very easy to examine X-ray imagination when we have negatoscope. Some experienced doctor, like here, may view radiographs with a bright light source without negatoscope. But really wise people can do this completely without light at all. And I'd like to tell you about advantages for modern X-ray examination. Now there are several advantages using and because it is possible, because scientists or doctors use digital technology in X-ray examination. Very sensitive receivers and digital technology gives this preference, these advantages in X-ray examination. What kind of? First is low radiation exposure. It means that only small dose of radiation a patient gets from the X-ray examination. Very good quality of images, excellent quality because of digital technology. high reliability. You will be sure that every shot, every episode of X-ray examination will result of high reliability, and it will be done very quickly, because modern apparatus, modern machine, X-ray machine, very easy in service, and they of course are very economical or profitable, or have a high profitability. Today I would say that the radiation exposure is less in 10 times than it was 20 years ago. So modern X-ray machine is absolutely have no danger for health. Sometimes we can compare the flight when we fly from Europe to America. This is Atlantic flights. We get more radiation than we get from the simple X-ray examination. What kind of method of X-ray examination used in medicine? Today in medicine there are several methods of X-ray diagnostics. That is in the list, and all of them allow not only to identify a wide range of disease, but also they facilitate more effective treatment. Surely you have already met with various methods of X-ray diagnostic, or at least heard about many of them. The most common used in the list below, and we can see personally each method. First is Röntgenography. Sorry, it is a small mistake. Röntgenography, or X-ray examination, in other words, another synonym, and it is probably the oldest known and simplest method. It is used when you need to quickly get an image of any part of the body. This is the old X-ray machine, but this is a modern and new 21st century X-ray machine. Very good look and very useful. Another method is called fluorography. Fluorography is a reduced X-ray examination. It is used in mass lung examination to detect tuberculosis. Today, especially in our country, every person has to check his lung, his organ of the chest, in fluorography. That is a picture of fluorography and visible lungs, the heart, diaphragm, and ribs, etc. Next, this is a funny picture I would like to share you. That is maybe used fluorography. It is a method of fluoroscopy in a nuclear explosion. And next method of röntgenology, we call such science as röntgenology, and that is a contrast radiography. Contrast radiography is performed after filling the vessels or some cavity structure with a special substance or special chemicals that absorb X-ray. And you see the picture of stomach, and it was filled with sodium barium, and it is a fluid which is white fluid. We drink it and it put in the esophagus and inside of the stomachs and make it visible. The central picture is knees, in the knees, and this is another idea. When we inject in the vessels some substance, some urotrust, we call this medicine or this medicine urotrust, or it would have another name, but it is circulate on our blood vessel, then come to the knees, and it is eliminated from the blood with kidneys, and all structure what contains the urina, and they contain urotrust and make visible knees and ureteres and cysts here. Another picture is right one, and we see the blood vessels injected by another radiopaque substance. And it's interesting if you see some abnormal situation. Here is I think this is the left artery, femoral artery, but here is the right femoral artery. And if you are a curious person, you can see the parts with labeled with this small atherosclerosis, or that is how to say endarteritis lesions in femoral artery. Usually people who like to smoke very well, after, I don't know, 20, 25 or 30 years can get some lesions, can get endarteritis in very often in femoral arteries, and without surgical operation then they can lose the lower extremity, one of the lower extremities. So smoking is really cool, I would say. Okay. Next method is fluoroscopy. We see and I told you about fluorography, but fluoroscopy, what is it? Fluoroscopy is the acquisitions of a dynamic X-ray image on a screen. That is the possibility to see organs or vessels or every part of our body in motion. And you can observe breathing movements, heart contractions, gastric perturbation, movement on contrast through the vessels, like here on the video. Let me show you. This is the coronary arteries injected with a special fluid, and this fluid absorbs X-ray, and it makes coronary artery visible. Okay. And the last one, last but not the least, this is the computed tomography. This is a layer by layer X-ray examination. First CT scan was done in California in 1972, but now it is very popular method, especially in pandemic period, for examination of our lungs. And almost every clinic today, every clinic in our university and other clinic have such computer scan for X-ray examination, but this is another idea. In this way, we can get a clear-cut image, like here. This is a cut image of the head, or it was possible to do in every part of our body. And also the modification of CT examination is a spiral CT scan. Maybe I explained already, because it is when source of X-ray moves on spiral, like here, and they construct all structure like bones. This is a three-dimensional objects in comparison with the simply CT scan. And sometimes it is very, very useful. So next part of our lecture will be dedicated of X-ray examination or X-ray anatomy of different part of the skeleton, of our skeleton. First is the X-ray anatomy of the skull. You can see all cranium bones. Here is mandibula, maxilla. Inside of maxilla we can nicely see sinus maxillaris. I will call all structure in Latin. Please hear it, and if you want, you can write. This one is a sinus frontalis in the os frontale. This one is sella turcica, os sphenoidale, ossis sphenoidalis, and this is a os occipitale, and big shadow in the centrum is pyramis of ossis temporalis. It is visible that this patient has some metal stift in the teeth, and also visible another soft organs of the face, like nose, lips, etc. What is this one here? Maybe you know that is os hyoidum. It is another bone of from the facial, from the viscerocranium. Okay. Next is the frontal and nasofrontal projection. This is the frontal projection of the skull. You see mandibula here. This one is maxilla. In the centrum is septum nasi. Septum nasi is that is the humor and lamina perpendicularis ossis ethmoidalis. You can see, but not very clear, sinus frontalis and sinus maxillaris. So usually doctors use another projection. We call it nasomental projection, and then in this way you can see all sinuses, frontal sinuses, maxillar sinuses, or Gymor sinuses, and this projection is used to diagnostic sinusitis or inflammation in the sinuses. And this is a spiral CT scan. When we use a spiral CT scan to see fracture, difficult because it is better to see. It is more clear to see fractures in the spiral scan imagination. Here is a fracture of the mandibular fracture here. But this is very difficult, very severe fracture of the calvaria or the neurocranium. It is really difficult fracture, very difficult damage. And maybe you will be interested in some another clinic or very serious damages of the skull with a nail and with some objects like I don't know what is it. Maybe it is a special things we use to cut fish in the mare, maybe, but I am not sure. And it is come into the skull, and this patient is still alive because it is a tube inside of trachea, and it means that is he is waiting for surgery operation. Another clinical X-ray image with the pituitary tumor. This is a tumor inside of cella turcica. This is a hypophysis tumor, and you can see that the Turkish saddle is expanded. Normal is small, but here is very big. It means that is a tumor inside of the saddle. X-ray anatomy of the spinal column. You can see all vertebra, cervical vertebra. This is the cervical part of the spinal column or vertebra column. This is the frontal projection, and here is lateral projection. My friends, I'd like to know if you can hear me well. Please give me feedback if everything okay with okay, thank you. So let's continue. And what kind of structure you can see on the frontal projection? This is the body of vertebra or corpus vertebra here. This is arcus vertebra, processus transversus here, processus spinosus. They looks like a drop, shadow drop, and this is on the lateral projection. You can see processus articularis and articulationes zygapophysalis or intervertebral joints. At intervertebral joints here, here, and here. Also is visible intervertebral discs between the two bodies here and here. And in lateral projection, it is possible to see atlant. Here is atlant. It's frontal arcus and posterior or anterior arcus or posterior arcus, and the second cervical vertebra we call axis. Here is axis and this is his dens. It is not possible to see axis and atlant in standard frontal projection, so we use a special method, special way when we ask patient to open mouth and take image, X-ray image, and then we can see atlant and axis in this open mouth projection. We call it is a special. It is like a life hack in medicine. Thoracic part. This is 12 thoracic vertebra. They are not very good visible in frontal and as well as in lateral projection, because here is this is heart and organs inside of our chest, and but if you are a little bit experienced, you can see body of thoracic vertebra, and this one and right and left point with this is a point where arcus vertebra connect to the body. It looks like oval shape figure here and here and here. That is not processus articularis. That is the arcus of vertebra. And sometimes you can see the arcus vertebra and processus spinosus in the centrum. You can see also ribs and joints between caput of ribs and body of vertebra. As well as on the lateral projection. Here is visible discs, intervertebral discs here and here and here, and it is interesting, you can see intervertebral foramina here and here. I hope you remember that through these foramina pass nerves, and if the foramina is narrow, it means that a patient can feel the pain when contraction, when we see contraction of intervertebral foramina. Lumbar part of spinal column is more visible because there are only organs in our cavity, abdominal cavity, and they contain air, like here. This is spots of air inside of our intestine, and but visible all of five lumbar vertebra. This is 5, and 1, first, second, third, fourth, and fifth lumbar vertebra. You see the intervertebral disc here, intervertebral disc, but in the front you see some kind of strange structure like here. It is not normal. It means that this patient have several osteochondrosis. It is a disease of apparatus of moving system, and usually it is shown like plus tissue plus bone structure in the front part of the vertebral body. It is also visible intervertebral foramina here, and this is a connection between thoracic and lumbar part of spinal vertebra. Also visible in the frontal projection, five lumbar vertebra, and usually we use this sign of the 12th thoracic vertebra when we see ribs. Ribs means that is a 12, but no ribs, it means is the first lumbar vertebra. And you can see also this is a sign. It indicates that this side is left, but this side is right, because it not is possible to see in real X-ray image. And this is an example of CT scan of vertebral column. It is very common. It's very common examination now, and you can see the sliced or cut images on different level. In sagittal projection, you see all vertebral column. Even you can see spinal cord inside, and other structure. If in comparison with the traditional X-ray examination, in CT scan you can see even soft tissue, not only hard tissue like bones, but also in muscles and ligaments, etc. And in typical CT scan, you can project, you can get every orientation, every projection you need. For example, here is a sagittal projection, but here is a horizontal projection. You see intervertebral disc, and inside of this disc is a nucleus pulposus. This is a fluid part of the disc. Annulus fibrosus and nucleus pulposus inside. Okay. And very useful is also an CT scan of lumbar vertebra. You can compare the normal lumbar part of vertebral column and osteochondrosis. I told you before that is a disease of bone tissue, and it is visible ships. We call this is a structure ships. This is a plus bone tissue, and also you see that some curving of lumbar part of the vertebral column. And clinical episodes, clinical cases. This is a fracture, compression fracture of lumbar vertebra. This is in traditional X-ray image, but this one is a spiral CT scan of a lumbar part, and visible two vertebra, fractured, damaged vertebra here. First, I think, yes, 1, 2, 3, 4, 5, first and second one. And this is also compression, but more complicated, more severe compression. Here is total destroyed body of lumbar, one of the lumbar vertebra. This is a compression fracture of cervical vertebra. Let me see, second, third, fourth, fifth, sixth. This is a sixth vertebral column, or vertebra cervicalis, sex. Okay, this is another picture of destruction. Here you can see body of lumbar vertebra, what was destroyed by a tumor inside of body, side of corpus vertebra, and it is almost destroyed this structure. Interesting episode. This is a curving. We call this scoliosis, S-shaped scoliosis here. And this is the before surgical operation. This is the after. You see how now it is possible, and it is very good, because it is not only the abnormal shape, it is also make pain in the body for those patients, and now everything is okay. X-ray chest anatomy. We see all ribs, first one, second, third, and different 12 pairs of ribs. We can see also the clavicular and sternoclavicular joints here. Not very good visible sternum, but it's possible to see this bone on the lateral projection. Okay. And spiral CT scan is very useful when we need to see bone structure. You can see the sternum very good. Every ribs is possible to see, because there is no inner organs on such image, because of the possibility of small possibility to absorb X-ray. Only good absorbing structure can be visible, such as a spiral CT scan. And this method is very useful when we need to diagnose fracture of ribs. Here visible some fractures, but it is not always possible. This is a several ribs fracture, and it is a very difficult situation. But if we take such method, spiral CT scan, you can see even small fractures here and here. X-ray anatomy of shoulder joints. This is visible in frontal projection. Maybe you know this is a humerus and caput humeri, scapula here, processus coracoideus, processus acromialis, and clavicula here. Usually we use special projection for examination of shoulder girdle. We use axial projection. It is when the X-ray source is up, but receiver is under the shoulder, and we can see better shoulder joints and the fissura of articulatio, fissura articularis, it is visible, and sometimes we see other structure. Clinical episodes, clinical cases. This is dislocation of the shoulder joints. You see that the caput is out of connection with the cavitas glenoidalis, and this is a typical fracture of the humerus in the surgical neck. Here is the anatomical neck, but also there is a surgical neck, and it is often very often the fracture line is come through the surgical neck here. You see the fracture of clavicula here. It's possible to see in the frontal projection, and sometimes is visible scapular fracture here. I hope you guess what the part of the scapula you see on this X-ray image. X-ray anatomy of elbow, not very often we don't use it is very often, but sometimes you can diagnostic dislocation. Here is no dislocation. All of structure, all of joints are normal in normal relations, but here is a typical dislocation of elbow joints. You see no contact between humerus and ulna, and this one is a fracture of olecranon. This is a part, processus olecranon or olecranon is fractured, is damaged. X-ray anatomy of radiocarpal joint. You see two bones, and here is visible a fracture. This is a typical fracture for radius usually, but all other bones of carpus are not damaged. Okay, this is the normal X-ray anatomy of the hand. You can see all bones, carpal bones, metacarpal bones, phalanx, digital phalanx, proximal, intermedium, and distal phalanx. And here, this is two hands. You see the letters left and right. It means it is a right hand, and this is the left hand. Usually in modern X-ray image, you see the date of examination and the name of patient and his birth date also. This is the same patient, and but another projection. It is visible in lateral projection, two hands in lateral projection. See, take a look of the fissura of articularis between the phalanx, this is a normal picture, but this is rheumatoid arthritis inflammation when patient have joints damaged with the process on inflammation, and this is almost no joints between carpal bones, and you see that the caput of metacarpal bones are big and the fissura is narrow because of the process. And very interesting picture with the polydactyly when people have not five digitus, but they have 1, 2, 3, 4, 5, 6, 7 finger on the hand. This is and you see this is a child, because this is the lines between epiphysis and diaphysis. We call it metaphysis cartilage, metaphysis cartilage, metaphysis cartilage, and it is not fracture. That is a cartilage inside, and cartilage absorb X-ray less than bone tissue and visible. X-ray anatomy of clinical medicine. This is clinical anatomy. This is the fracture of metacarpal bones, and here you see scaphoid fracture. Lower limb bones. We start from pelvis. X-ray anatomy of pelvis. This is a normal adult pelvis. You see all bones in connection between pelvis and sacrum, sacroiliaca, articulatio sacroiliaca. Here, left and right, you see that is a point letter right. It means that is a right articulatio. And you see also symphysis, pubica, and hip joints. But if we take a look of children pelvis, you see that is not complete bones, not whole bones. You see os pubis, os ischii, and os ilium. They are have connection in acetabulum, but visible that between those bones are cartilages, and also the caput femoris have metaepiphyseal cartilage inside here. It is not fracture. Don't be confused. That is a normal view of of child pelvis. A clinical anatomy fracture of the pelvis bones, very severe fracture. Almost 20 or 25% of people died when they get it. And this is after surgical operation, osteoarthritis of pelvis bones and femur, very severe damages. Okay, and extraneous objects in the pelvis, that is after surgical operation. Sometimes doctors forget instruments inside of pelvis, and sometimes you can find such objects in the pelvis, even the mobile phone inside. X-ray anatomy of hip joints. It is on frontal projection. Sometimes we use axial projection in direction from up to bottom, and it is better visible of combination in hip joints in this point. And I told you before in previous lecture about the normal signs of hip joints. I don't want to repeat it again. And this is clinical cases. This is a hip fracture between typical fracture of the hip joints is between caput and neck or column femoris. This is a fracture of column femoris. And what we should do, we can replace fractured bones and use prosthetic hip joints for it. X-ray anatomy of the knee joints, we don't use it very often now because we have CT examination or MRI examination, more common. This is an adult, but this is a child. You see the cartilaginous metaepiphysis cartilaginous inside. And the letter L means left, but P means правая or right lower extremity. This is a CT scan of knee joint. You see all structure made from soft tissue, even adipose tissue. Meniscus here is visible. Ligamentum cruciforme, ligamentum inside of knee. This is a ligamentum cruciforme of knee joints, and even you can see the skin. Such imagination. It is C-scan, but we can use it in the three-dimensional project, and when we see all bone structure. Here is the bone patella, femur, and tibia. But you can see that there's some kind of process. It is inflammation, severe inflammation, when the surface is like stone street, but the best way to see all structure inside of knee joints is the MRI scan. Visible all of structure, even the pleats of even the somewhat cruciforme or cruciatum ligament inside. This is a normal joint. This is a joint with disease, but here is a prosthetic knee joints. Very often now people replaced knee joint and use artificial joints. Sometimes this helps a lot. And another X-ray imagination of ankle joints. This is a normal frontal and lateral projection, but here is a fracture of lateral malleolus or malleolus lateralis here, and on the frontal projection is not visible, but on the lateral projection is visible how dislocation is, how far we get dislocation in these joints. X-ray anatomy of the foot also very useful to diagnose flat feet, and sometimes we can see fracture, even small bones like proximal phalanx here, and it is a small fracture of this. When people get older, they get hallux valgus. This is the deformation of the first bones of hallux. This is the first digitus in the foot. So this is deformation when the hallux moved on the lateral position. The angle is open to the lateral. So it is also very often situation for old people. And polydactyly. This is 1, 2, 3, 4, even 8 digits, 8 bones in the every foot. Of course, if it is not a joke, if it is not Photoshop work. I hope so. This is all for today, my friends. I'm going to put a special task for you in Moodle in 15 minutes. Don't forget, visit our Moodle and try to find some anatomical structure on X-ray images I will put soon. So I wish you everything good and good luck, and hope to what did you say? Moodle doesn't work well. Okay, you can have time till tomorrow. I hope you can do this task today every time. I know it doesn't work now, but it will work. It will work in the evening. So I hope, or if you can do this task even tomorrow. I hope Moodle will be fixed till tomorrow. Thank you very much, and see you next Monday. Bye bye.